Welcome to Section 2 of Ophthalmology, where we get into the specifics of ocular surface disease. Next 10 minutes, you will learn what ocular surface disease is. We'll go through a quick checklist of signs and symptoms. We'll create a short list of predisposed breeds. We'll talk about some tear facts and fiction. And then we'll go through the what, why, and how management of dry eye. What are ocular surface diseases? These are disorders comprising the cornea, conjunctiva, eyelids, and lacrimal glands. The cornea is the transparent layer that forms the clear dome at the front of the eye. Tears are made in part from the lacrimal glands. What are the symptoms you should be looking for? Red eyes, frequent rubbing of the eye area with a paws, watery eyes, tearing and tear staining of the fur around the eyes, accumulation of secretions and or debris on the eyelashes, eyelids, and in lid margins, evidence of pain or soreness near the animal's eyes when you try to clean them. As we talked about in the first presentation, eye conditions are urgent. You want to diagnose and manage ocular surface disease early. Just like cataracts can cause blindness, as seen in the Labrador at the top, ocular surface disease in the Shih Tzu can seriously impact eyesight and quality of life. Have you ever been asked if dogs cry? Dogs don't have emotional tears. They can show their distress and emotions in other different ways. They do have basal tears and reflex tears. Reflex tears are in response to irritation, like you or I have when we're chopping onions. Tears are vitally important in helping to keep the cornea healthy. Without tears, eyes become irritated. The conjunctival tissues around the eyes get red, the cornea itself in time will turn brown in an effort to protect the eye, and a gooey yellow discharge predominates. Blindness can result. Did you know that tears contain more than water? Tears consist mostly of water, but also of oil and mucus secreted from respective glands in the eyelids and conjunctiva. The water portion of tears is secreted by two lacrimal glands in dogs and cats. One gland is just above the eye and another in the third eyelid. Tears drain down the nasolacrimal duct that exits in the nose. Tears are triple-layered, high-tech lubricants. First, the oily outer layer prevents evaporation. Then, the watery middle layer is lubrication. And last, the mucus innermost layer helps the tear film spread across the cornea. When you blink, the eyelids act as windshield wipers to spread the tears across the cornea so it is evenly coated. Dogs and cats also use their third eyelid. There must be a proper combination of tear production and spreading to allow the cornea to remain clear and healthy. Tears have multiple jobs to keep those corneas pristine. They contain antibacterial proteins and salts and serve to flush away the irritants and infectious agents that are constantly getting in our eyes. Since the outer portions of the eye do not have a blood supply to bring nutrients and remove metabolic waste, it's up to the tears to provide these services. Multiple factors can cause abnormal tear production or distribution. Some of the most common are allergies, infections, immune-mediated reactions, hormonal deficiencies, injuries, abnormal growth, nerve damage, environment, genetic predisposition, congenital anomalies, use of trimethoprim sulfa, or radiation therapy. KCS, or dry eye, deconstructed. Keratosis refers to the cornea, or clear dome, of the eye. Conjunctiva are the moist pink membranes of the eye socket. Itis means inflammation, and ceca means dry. So keratoconjunctivitis ceca, abbreviated as KCS, means there's an inflamed, dry cornea and conjunctiva. KCS, or dry eye, occurs when there is a deficiency in the water portion of the tear film, which normally accounts for 95% of the tear volume. Without the water layer, one is left with oil and mucus, hence the gooey, yellow eye discharge characteristic of this condition. The top two reasons for dry eye in dogs include anesthesia, which will reduce tear function temporarily, therefore eyes must be lubricated with ointment for every procedure. But the most common cause of KCS appears to be immune-mediated destruction of the tear-producing gland tissue. We do not know what causes this type of inflammatory reaction, but several breeds are predisposed, including American and English Cocker Spaniels, Springer Spaniels, miniature Schnauzers, West Highland White Terriers, and Cavalier King Charles Spaniels. KCS or dry eye in cats, common, uncommon, or rare? KCS is considered to be rare in cats. In cats, herpes upper respiratory infection can lead to a chronic dry eye. This may be due to tear duct occlusion and inflammation, along with viral damage to the mucin-producing glands in the conjunctiva. Because KCS is less often immune-mediated, this impacts treatment decisions. Let's repeat. You want to diagnose and manage KCS or dry eye early. Just like cataracts, KCS can seriously impact an animal's eyesight and quality of life. Immune-mediated KCS results in the loss of the tear production. The cornea is deprived of oxygen and nutrients, debris accumulation and bacterial overgrowth cause inflammation and irritation, the cornea loses its shine, can look irregular and ulcerate, the conjunctiva becomes red, squinting, and pain is evident. Depending on the severity, blood vessels and pigment can be seen on cornea, along with inflammation of the eyelids and skin around the eyes. So how do you avoid missing the diagnosis of KCS? Any patient with ocular surface inflammation, discharge, or corneal opacification should undergo the Schirmer tear test. If this step is skipped, many cases of KCS continue to go undiagnosed or untreated. There are many options for treating the eyes, including the iMed line of products. iMed Animal Health is focused on providing veterinary professionals with the most innovative and effective products at an affordable price. Any red eye needs a Schirmer tear test. When a patient presents to you with advanced KCS, the diagnosis may be pretty obvious, but early on in the course of disease, it may look like a simple case of conjunctivitis. In either case, it is important to measure the tear production to determine how dry the eyes are. Here is a quick reference guide for the Schirmer tear test in dogs and cats with a red eye. Treatment objectives for KCS start with eliminating the cause if possible. Stimulate the tear production, replace the tear film, control and prevent secondary infection, and reduce the inflammation. There are some treatment essentials for immune-mediated KCS. Immune-modulating medication increases tear production, decreases inflammation, and decreases pigmentation. Topical cyclosporin impacts the immune cell function and directly stimulates tear production. It needs 4 to 6 weeks for maximum effect. Topical tacrolimus, similar mechanism to cyclosporin, but much more potent. Reserved for dogs not responding to cyclosporin as there is no commercial product. Tacrolimus must be formulated from a reputable compounding pharmacy. The surgical procedure, parotid duct transposition, is a potential solution to unresponsive severe KCS. It is a delicate procedure performed by a veterinary ophthalmologist. The iMed line of products can be a key part of treatment and management of KCS. When thinking about eye lubricants, viscosity is important. Aqueous-based products will have limited use due to short duration of action versus other, more viscous gels. Treatment frequency will depend in part on viscosity. Advanced products contain sodium hyaluronate with enhanced viscoelastic properties to mimic tears. Lubrication will be needed hand in hand with cyclosporin, especially in the beginning. When we look at the prognosis, dogs with Schirmer tear tests as low as 2 mm still have an 80% chance of responding to cyclosporin. This medication has been a miraculous breakthrough in the treatment of KCS. There are other ways you can support your owners of dogs with KCS. With the most common cause of KCS being immune-mediated, owners need to know therapy will be lifelong, and initially lubrication could be every couple of hours. Healthy treat options in association with medication can maintain that trust and bond. Take the time to calculate acceptable daily treat calories to make it easier for your owners to maintain overall health. KCS is a common cause of corneal ulceration in dogs. Move on to our next segment for more 10-minute takeaways on corneal ulcers.